Hello aspirants, welcome to GDC English classes. So in this session, we will discuss about one of the model paper for Telangana Pharmacist, that is grade 2 Telangana Pharmacist. And so here this is the model paper number 3. So let's go for the first MCQ. So what is the first MCQ here? So the process of erythrocyte formation in red bone marrow is known as. So simply here the question is the formation of erythrocytes in the red bone marrow is known as erythropoiesis, erythrocytes, erythromegaly, erythropoietin. I hope the question is very simple and I hope you can easily give the answer. So erythropoiesis is nothing but production of red blood cells and erythrocytes nothing but blood cells and erythromegaly excess production over size of the RBC or erythropoietin nothing but one of the hormone releasing from the kidney especially during the hypoxia low levels of oxygenated blood supply. So by this the answer is simply the answer for this MCQ is simply that is erythropoiesis. It is a process of erythrocyte formation in the red bone marrow. Red bone marrow. So here let's see the explanation for more clear information. So the process of erythrocyte formation in the red bone marrow is disrupted by deficiency of dietary factors like iron, folic acid, vitamin B12, and it leads to anemia. So generally formation of red blood cells in the bone marrow is erythropoiesis. So lack of some factors in the diet like iron, folic acid, vitamin B12 may lead to the anemia. And next MCQ is regarding next MCQ anticholinergic drug. So anticholinergic drug used as a diagnostic agent for myasthenia gravis. So this is a common question you can see in the many number of pharmacology exams. So what is myasthenia gravis? It is an autoimmune disease in which muscle become weak due to destruction of nicotinic muscle receptors and leads to the muscle weakness and may also lead to the muscle paralysis. So how can you diagnose this myasthenia gravis by using option like galantamine, hydroconium, ecothiopate, pyridostigmine. So galantamine, ecothiopate, pyridostigmine, hydroconium, all these are considered indirectly acting reversible acetylcholine esterase enzyme inhibitors. And among these, hydroconium is used as a diagnostic agent. Hydroconium is used as a diagnostic agent for the myasthenia gravis. So hydroconium because of its fast onset of action and a short duration of action. So it shows action immediately. It shows action immediately and having less duration of action, less side effects. So the explanation. So Hydroconium is a quaternary ammonium compound. Sorry for interruptions. So hydroconium is a chemically quaternary ammonium compound. It is suitable for diagnosis of myasthenia gravis, an autoimmune disease in which our own antibodies damage NM receptors on skeletal muscle and decrease the muscle capacity to contract. Decrease the capacity of muscle to produce contraction. So here you can see the image also. So myasthenia gravis, there is a damage of NM receptors. So hydroconium inhibit the acetylcholine esterase enzyme and decrease the metabolism of acetylcholine, increase the levels of acetylcholine. That acetylcholine binds to muscle and produce contractions. And let's go for the next MCQ. So regarding the next MCQ, drug used in acute myocardial infarction all except. So among these, there are list of drugs. All these drugs are helps in the treatment of myocardial infarction. So due to decreased blood supply to some part of the heart, so there is a death of particular type of heart cells, myocardial infarction. So plasminogen inhibitor, thrombolytics, antiplatelets, alter play. So all this can be useful, but except one of the drug is not used in myocardial infarction. Not used in the myocardial infarction. That is so. The exception of this case is plasminogen inhibitors. Plasminogen inhibitors. The answer is plasminogen inhibitors. So let's see the explanation for more clear information. So regarding the information, so here the tissue plasminogen activators used in acute myocardial infarction, not the inhibitor. So plasminogen activators are used in myocardial infarction, but not plasminogen inhibitors. The drugs which activate the plasminogen are used in treatment of myocardial infarction. And thrombolytic agents like streptokinase, urokinase, alteplase, reteplase used to break down the formed clots. And antiplatelet drugs like aspirin are started to prevent reinfraction. So once myocardial infarction treated, it should not occur again. So for that purpose, to prevent reinfraction, formation of infraction again, to prevent that reinfraction, aspirin will be the drug of choice. Aspirin will be the drug of choice. Next. So next MCQ is so drug that potentiates inhibitory effect of GABA. Drug that potentiate increase the drug potentiate inhibitory effect of GABA. Which of the following drug increases potentiates the effect of GABA? Gamma aminobutyric acid, one of the inhibitory neurotransmitter in central nervous system. So drugs like alprazolam, flurazepam, triazolam, barbiturates, potentiates. So alprazolam, flurazepam, triazolam, these all comes under the benzodiazepines category. And barbiturates potentiates mimics the action of GABA and may increase the risk of side effects also. Increase the risk of side effects also. So the answer is barbiturates. Answer is the barbiturates. Barbiturates are the drugs potentiates increase the severity of GABA function. Increase the severity of GABA function. So let's see the explanation. So barbiturates are substitute derivatives of barbituric acid, that is malonylurea, and barbiturates having GABA facilitation with the GABA action potentiate the inhibitory effect of GABA, increase the effectiveness of GABA, increase the inhibitory activities in the central nervous system. At high concentration, barbiturates have GABA mimetic effect. That is, barbiturates can directly increase chloride in conductance into the neuron. So, excess influx of Cl minus into the neurons produce hyperpolarization. Hyperpolarization. So let's go for the next MCQ. The following anti-epileptic drug also effective in manic depressive illness. Manic depressive illness. So here the question is so following anti-epileptic drug also effective in treatment of manic depressive illness. Options like ethosuximide, a T-type calcium channel inhibitor, helps in the treatment of obscene seizures, Primidone, phenobarbital, carbamazepine. Carbamazepine. So all these are anti-epileptic drugs. And which among the one is helps in the treatment of manic depressive illness? The answer is carbamazepine. A drug block sodium channels and decrease the firing of neurons. Answer is carbamazepine is an anti-epileptic drug effective in the treatment of manic depressive illness like bipolar disorder. So the person sometimes in the sadness, sometimes in the happiness. So like mood stabilization is required. So let's see the explanation for clear information about this MCQ is so manic depressive illness is bipolar mood disorder. Carbamazepine used as an alternative to lithium as a mood stabilizer. So lithium carbonate is first clinically successful drug for treatment of manic depressive illness. Lithium carbonate is a mood stabilizer, and antiepileptics like carbamazepine was found to control mania and to prolong remission in bipolar disorder. Helps in the treatment of bipolar disorder. Next. So let's see the next MCQ. So what is the MCQ here? The MCQ is which of the following is medium efficacy thiazide like diuretic? So there are many number of diuretics like loop diuretics, carbonic anhydride, osmotic diuretics. Okay, so among these, which one is medium efficacy? Which one is medium efficacy? So regarding here, example like benzethiazide, a thiazide diuretic, bumetanide, chlorthalidone, hydrochlorothiazide. Which of the following is medium efficacy thiazide like diuretic? So benzethiazide, bumetanide, chlorthalidone, hydrochlorothiazide. So chlorthalidone. So chlorthalidone is a thiazide like diuretic. It is medium efficacy. Medium efficacy. So the answer is chlorthalidone, indapamide, metolazone are thiazide-like diuretics, and the benzethiazide, hydrochlorothiazide are thiazide diuretics. So thiazide-like diuretics having same mechanism of action inhibit sodium chloride synthesis at the distal convolutive tubule. And both the thiazide-like diuretics differ in their chemistry, arrangement of structure. Okay. So let's see the explanation. So here for the explanation we have to go through the classification. We have to must go through the classification. So high sealing diuretics are also known as loop diuretics like furosemide, bumetanide, torsemide, ithacranic acid. Ithacranic acid drawback, it can cause ototoxicity, severe ototoxicity. And the medium efficacy diuretics are benzothiazide, thiazide-like diuretics. Benzothiazide as a thiazide-like diuretics. So benzothiazide, hydrochlorothiazide, hydroflumethiazide, as well as benzothiazide. And thiazide-like diuretics, chlorthalidone, metolazone, zipamide, indapamide, as well as clopamide. And the weak are supportive diuretics, carbonic anhydride inhibitors like acetazolamide, and potassium sparing diuretics, aldosterone antagonist, spironolactone, eplerenone, and renal epithelial sodium channel blocker, amilorate triamcinolone, and osmotic diuretics like mannitol isosorbate as well as glycerol. Mannitol isosorbate as well as glycerol. So this is a simple classification of diuretics. So next MCQ. The next MCQ is the pharmacological action of alpha blockers except. So alpha blockers nothing but they block the alpha receptor selectively as well as non-selectively. So pharmacological action of alpha blockers except decrease cardiac output, causes meiosis, it can inhibit the ejaculation, increase the tone of smooth muscle bladder, increase the tone of smooth muscle bladder. So decrease the cardiac output, causes meiosis, inhibit the ejaculation, increase the tone of increase the. So the answer is here. Sorry. The answer of this MCQ is increase the tone of smooth muscle in bladder. So due to blocking of alpha receptor, there is a decrease the tone of bladder of the smooth muscle bladder. So let's see the explanation. The alpha blockers function on heart. Alpha blockers functions on heart. So So on heart, alpha blockers decrease the total peripheral vascular resistance, decrease the cardiac output, partial hypotension due to blocking alpha receptor, and finally decrease the blood pressure. Ultimately decrease the blood pressure. And on the eye, alpha blockers dilate the iris papillae muscles due to blockade of alpha receptor, causes meiosis, constriction of pupil of eye, decrease the pupil size. Alpha blockers on the urinary system decrease the tone of smooth muscle in bladder, trigone, sphincter, as well as prostate. Urine outflow in benign prostatic hyperplasia, patient improved. So increase the urine outflow, alpha blockers. So alpha blockers on the respiratory system, contraction of vas deferens and seminal vesicles. Alpha blockers can inhibit ejaculation, causes impotence. Decrease the interest to participate in the sexual activities. Decrease the interest to participate in the sexual activity. Next, eicosanoids are group of compounds. Next MCQ is eicosanoids. Eicosanoids are group of carbon unsaturated fatty acid. So eicosanoids generally contains a 20 number of carbon atoms. The simple answer is it containing 20 number of carbon atoms. That is eicosanoids are the group of compounds. The answer is option A. So eicosa means 20. So the meaning is here simply eicosa means 20. Hence the general name is eicosanoids for prostaglandins, thromboxanes, leukotrienes, which contain 18, 20, 22 carbon skeletons. So this is a arachidonic acid, and this arachidonic acid is a precursor for this arachidonic acid is a precursor for this arachidonic acid precursor for this eicosanoids. Eicosanoids are examples like prostaglandins, thromboxanes, leukotrienes. Next, the specific side effect of ambrinon is the specific side effect of ambrinon. So, ambrinon, milrinone are phosphodiesterase enzyme 3 inhibitors helps in the treatment of congestive heart failure. So, ambrinon, specific side effect of ambrinon, arrhythmia, thrombocytopenia, hypotension, seizures. So, thrombocytopenia is the specific side effect of this ambrinon. Specific side effect of this amidon. The answer is option B, thrombocytopenia. Thrombocytopenia. Next, amidon. Amidon is a chemically bipyridine derivative selective phosphodiesterase enzyme 3 inhibitor in heart. They called inodilators because due to their positive inotropic increased cardiac output on heart and vasodilation on blood vessels reduce both preload as well as afterload. So on the heart, increasing number of contraction positive inotropic on the blood vessel dilation. That's why inodilators. And thrombocytopenia is a major side effect of amidon. It is a rare with milrinone. Hence, milrinone is preferred over amidon in the treatment of congestive heart failure. However, milrinone is more arrhythmogenic. So, milrinone may increase the chance of arrhythmias, abnormal rhythm in the heart. Abnormal rhythm in the heart. Next, clinical use of progesterone include the following except. So, all of the following are clinical applications of progesterone nothing but pregnancy maintaining hormone. Except is option endometriosis, dysfunctional uterine bleeding, endometrial carcinoma, and vulvovaginitis in the children. Vulvovaginitis in the children. So the answer is here vulvovaginitis in children. So progesterone can help in treatment of endometriosis, a type of endometrial cancer, dysfunctional uterine bleeding, abnormal bleeding, and endometrial carcinoma, cancer of endometrium. So here, the clinical applications of progesterone, progesterone used as a contraceptive to prevent unwanted pregnancy and help as a hormone replacement therapy to reduce dysfunctional uterine bleeding, helps in endometriosis, decrease the over division of excess division of endometriosis and decrease the chance of cancer of endometrium and premenstrual syndrome as well as tension, threatened or habitual aversion, and endometrial cancer. So these are the clinical applications of progesterone, clinical uses of the progesterone. So next MCQ is regarding the next MCQ, which of the following is first and prototype drug of high ceiling diuretics? So high ceiling diuretics, high efficacy. Efficacy nothing but intrinsic activity, pharmacological action, high action. So which of the following is first and prototype? Prototype means first drug from particular class. So option like furosemide, bumetanide, torsemide, all of these. So the answer is simply the answer for this MCQ is furosemide. Furosemide is the first drug from this class of diuretics. So let's see the explanation of this MCQ. So High ceiling diuretics, nothing but loop diuretics. Axon, thick ascending limb of loop of Henle, inhibits sodium potassium 2 chloride water. And example like furosemide, bumetanide, torsemide, ethacronic, and all are diuretics, nothing but loop diuretics. Furosemide, first and the prototype drug in this class. The introduction of this rapidly acting, highly efficacious oral diuretic, the maximal natriuretic effect. So increase the elimination of sodium. So along with sodium, water also eliminates. So it can be taken by injection into the vein or by mouth also. So oral route as well as a injection parental route. Parental route. So let's see the next MCQ. So what is the next MCQ here? Insulin hormone is secreted from which cells? So that is very simple. I hope you know the answer already. So alpha cells, beta cells, pancreatic polypeptide, as well as epsilon cells. You know, beta cells of pancreas releases insulin, and alpha cells release the glucagon, and delta cells release the somatostatin. So you know the answer for this question. So that is beta cells produces the insulin from the pancreas. So let's see here. So like this information is very very important. They will ask question from the basic points only. They will ask question from the basic point. So simply alpha cells produces glucagon, stimulate the conversion of stored glycogen to glucose, stimulates the glycogenesis, and beta cells releases insulin, control blood glucose levels by signaling the liver, muscle and fat cells to take in glucose from the blood. So from the blood, glucose added to the tissues. And delta cells releases somatostatin, a inhibitory hormone of both insulin as well as the glucagon. And FRPP, polypeptide cells produce pancreatic polypeptide, inhibit the release of digestive secretion of the pancreas. So pancreatic polypeptide inhibit the release of digestive secretions from the pancreas. So this is a simple explanation. So next MCQ, choose the correct use of the antiplatelet drug. Acute myocardial infarction, coronary bypass implants, cerebrovascular disease, all of the above. Antiplatelet drugs. Antiplatelet drugs, name itself indicating they decrease the platelet aggregation and helps the disease of clotting related disorders, nothing but diseases. So the simple answer for this MCQ is all of this. So antiplatelet drugs used in acute myocardial infarction, as well as coronary bypass implants, cerebrovascular disease, as well as all of this, as well as all of this. So uses of antiplatelet drugs. Uses of antiplatelet drugs used in unstable angina, acute myocardial infarction, hemodialysis, coronary bypass, venous thromboembolism, formation of clots in deep vein, cerebral vascular disease, pulmonary hypertension. These are the list of the clinical uses of the antiplatelet drugs. Clinical use of the antiplatelet drugs. So the next MCQ is, what is the mechanism of action of aspirin? So what is the mechanism of action of aspirin? So the mechanism of action of aspirin is inhibit COX-2 enzyme only, inhibit COX-1 enzyme only, inhibit COX-4 as well as COX-2 reversibly, inhibit COX-1 and COX-2 irreversibly. So aspirin, acetyl salicylic acid, aspirin is the only NSAID irreversibly inhibits both cyclooxygenase 1 and 2 by causing acetylation of serine residues in the COX enzyme. So aspirin is the only non-steroidal anti-inflammatory drug inhibit COX-1 and COX-2 irreversibly by causes acetylation of serine residues in cyclooxygenase. Cyclooxygenase. So the answer is inhibit COX-1, COX-2 irreversibly by acetylation of serine residues. By acetylation of serine residues of cyclooxygenase. Cyclooxygenase. So let's see the explanation. So this is the structure of aspirin. So this is the structure of aspirin. So acetyl salicylic acid, it is a non-selective, irreversible inhibitor of both COX-1, COX-2, but it is weakly more selective for COX-1. It does so by acylating the hydroxyl of serine residue in enzyme. Normally, COX produces prostaglandin, most of which are pro-inflammatory thromboxanes which promote the clotting. So aspirin inhibit the COX-1, COX-2 enzymes in irreversible manner. Next, choose the correct uses and mechanism of action. Choose the correct use as well as a mechanism of action. Next MCQ. Choose the correct use as well as mechanism of action. So options: termination of pregnancy, cervical ripening, Cushing syndrome, all of this. Choose the correct uses and mechanism of action, please. Mechanism of action. So termination of pregnancy, cervical ripening, Cushing syndrome. So the answer is, look, let's check here. All of this. So termination of pregnancy, if pregnancy going further not required, cervical ripening during the delivery of the baby, Cushing syndrome. So uses and mechanism of action. So here, the answer is, we already saw all of these are correct uses as well as mechanism of action. I think there should be an extension. I think termination of pregnancy, nothing but I think there should be a little bit increments in the question. I think so. Next, an essential fatty acid and a precursor in the biosynthesis of prostaglandins, thromboxanes, leukotrienes. So an essential fatty acid and a precursor in the biosynthesis of prostaglandins, thromboxanes as well as leukotrienes. So options like arachidonic acid, fatty acid, acetic acid, ascorbic acid. I hope you already got the answer. The answer is arachidonic acid. Answer is arachidonic acid. So this is the path for mechanism of action of NSAIDs as well as synthesis of many prostaglandins. So membrane phospholipids gives arachidonic acid in presence of phospholipase A2. This arachidonic acid in presence of COX cyclooxygenase 1 and 2 gives prostaglandin G2 gives prostaglandin H2 and this isomers further gives E2 D2 F2 alpha and thromboxane synthase gives thromboxane A4 to thromboxane A2 and prostacyclin synthase gives prostaglandin I2. And other side, 5-lipoxygenase enzyme produce leukotriene A4, further produce leukotriene B4, leukotriene C4, D4, E4. So these are the different byproducts of arachidonic acid like prostaglandin, thromboxanes, leukotrienes, etc. And on this, our NSAID shows the action. So, for example, steroids like glucocorticoid inhibit phospholipase 2 and prevent the production of arachidonic acid. Prevents the production of arachidonic acid. And NSAID inhibit COX enzyme. And Gilluton inhibits Gilluton. Sorry for inconvenience. Gilluton inhibit 5-lipoxygenase enzyme. Next MCQ. So mifepristone, nothing but mifepristone is anti-androgen, anti-estrogen, anti-progestin androgen. So mifepristone is a progesterone antagonist. Block the progesterone receptor. Mifepristone is a progesterone antagonist. So mifepristone is a anti-progestin. So it is primarily an anti-progestin, also has anti-androgen as well as anti-glucocorticoid property, but mifepristone is primarily a progesterone antagonist, block the progesterone receptors, and also having weak anti-androgenic and anti-glucocorticoid effect. Next MCQ. The next MCQ is Choose the correct adverse effect of cardiac glycoside. So cardiac glycosides are like digitalis, helps in the treatment of congestive heart failure. So abdominal pain, gynecomastia, arrhythmia, as well as all of these. So definitely cardiac glycosides like digitalis use digoxin may produce abdominal pain on GIT, gynecomastia, abnormal enlargement of breast in males, and arrhythmias, abnormal heart rhythms. Abnormal heart rhythms. So definitely the answer will be the all of these. All of these are the side effects of cardiac glycoside like digitalis. So the adverse effects of glycosides like anorexia, loss of appetite, nausea, vomiting sensation, vomiting, abdominal pain, skin rashes, diarrhea, gynecomastia, and any type of arrhythmia can happen. So in the arrhythmias, bradyarrhythmias, tachyarrhythmias, and based on the number of heartbeat, different arrhythmias are there. So any type of arrhythmia can be the side effect of digitalis, can be the side effect of digitalis, cardiac glycoside. And next MCQ is which of the following carbonic anhydrase inhibitor is effective as anti-convulsant drug? Effective as anti-convulsant drug. So acetazolamide, methazolamide, trihexyphenidyl, topiramate. So topiramate is an anti-epileptic drug but not a carbonic anhydrase inhibitor. Trihexyphenidyl is not an carbonic anhydrase inhibitor. Both methazolamide and estazolamide are carbonic anhydrase inhibitors. But among this, which one is the anti-epileptic drug? Among this, which one is anti-epileptic drug? Which of the following carbonic anhydrase inhibitor is effective as anticonvulsant? So, sorry for inconvenience. The answer is topiramate. Answer is the topiramate. So, let's see the clear information. So, topiramate is a weak carbonic anhydrase inhibitor with a broad spectrum of anticonvulsant action. It's been approved for prophylaxis of migraine. It is a monosaccharide, acts by multiple mechanisms. So, chemically, it is a monosaccharide, block the sodium channels, enhance the GABA function, inhibitory neurotransmitter function, thereby potentiate effect of GABA, block AMPA receptor, a glutamate ion channel receptor, AMPA receptor. So, epilepsy is because of over domination of excitatory neurotransmitter. Anti-epileptics decrease the excitatory neurotransmitters like aspartate glutamate function and increase the function of inhibitory neurotransmitters, GABA as well as glycine. GABA as well as glycine. Next, the last MCQ of this model paper is atypical antidepressant is imipramine, amoxapine, bupropion, citalopram. Bupropion, citalopram. So bupropion. So definitely the answer will be the bupropion is an atypical antidepressant. The answer is bupropion, not imipramine, not amoxapine, not citalopram. So let's see the mechanism of action of this antidepressant. Sorry, classification of antidepressant. So first, reversible inhibitors of MAO enzyme A, like moclobamide, chlorxylene. Moclobamide is reversible inhibitor, and tricyclic antidepressants like noradrenaline plus serotonin reuptake inhibitor, noradrenaline plus serotonin reuptake inhibitor, imipramine, amitriptyline, trimipramine, doxepin, dozapine, clomipramine, and predominantly noradrenaline reuptake inhibitor, predominantly only inhibit noradrenaline reuptake, desipramine, nortriptyline, amoxapine. Next, selective serotonin reuptake inhibitor like fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram. Next, serotonin and noradrenaline reuptake inhibitor SNRI. SNRI like venlafaxine, duloxetine, desvenlafaxine. Next, atypical antidepressants like trazodone, miancillin, mirtazapine, bupropion, tianeptine, epinephrine. So bupropion is used to decrease the smoking addiction, to control, to help in de-addiction of smoking, to help in de-addiction of smoking. Okay. So this is a discussion regarding the model paper 3 part, especially for Telangana Grade 2 Pharmacy. I hope you are preparing in full mode. So only less time is there, but the time is very enough. Whatever thing you are studying, read particular topic, close the book and revise it and practice the MCQs. Make it as a habituation. Okay, all the best. Thank you. Subscribe to GDC English classes.